Do you frequently feel like your heart aches sometimes? Or does your baby seem weaker than normal when feeding or lifting their head? What if it's not just tiredness, but something hidden inside the body's energy system? Meet Pompe disease, a rare condition where the body can't properly break down a type of sugar stored in muscles called glycogen. Think of glycogen as energy packed in a box. Normally, the body opens this box to use energy when needed. But in Pompe disease, the key to open the box is missing or broken. So energy stays locked away, making muscles weak, especially the heart and breathing muscles. It can affect babies and adults, but babies often show signs early and severely. Does that sound familiar? It's rare but real, and understanding it early can help families act faster. So what causes Pompe disease? Imagine your body is a big factory, and enzymes are the workers that do specific jobs. One important worker is called acid alpha-glucosidase, or GAA for short. This enzyme's job is to break down glycogen in a part of the cell called the lysosome. Think of it as the recycling center. In Pompe disease, the GAA enzyme doesn't work or is missing because of a typo in the instruction manual, the DNA. These typos, mutations, come from parents. If both mom and dad pass the broken instruction, the child can't make working GAA. No worker, no glycogen breakdown. The energy piles up like trash in the recycling center, hurting cells, especially in muscles. It's like a car with a full gas tank, but no way to use the fuel. The engine sputters, and so do the muscles. How do you know if someone has Pompe disease? Let us play a quick game. What is wrong here? Example 1. A 3-month-old baby feels floppy when held, has trouble feeding, breathes fast, and their heart looks big on an X-ray. That is a red flag. Floppy baby with heart issues often means infantile onset Pompe. Example 2. An adult starts wobbling when climbing stairs, cannot lift their arms fully, and feels short of breath lying flat. This could be late onset Pompe. Both cases link to muscle weakness, breathing trouble, and fatigue. But because symptoms grow slowly, they are often mistaken for other problems, like asthma or aging. That is why asking, "Why are my muscles failing even though I eat well?" can lead to the real cause. Early signs save lives, especially in babies, where heart and breathing muscles weaken fast. How do doctors find out it's Pompe? First, they ask, any family history of muscle disease? Then they test the blood for GAA enzyme activity. Low levels mean possible Pompe. Imagine testing a phone's battery. If it charges but won't turn on, the issue isn't power, it's the system. Same here, the body has glycogen, but can't use it. Genetic testing confirms the DNA type. Now treatment, we can't fix the DNA yet, but we can send in replacement workers. A medicine called enzyme replacement therapy, ERT. It's like mailing new GAA enzymes into the body through IV every 2 weeks. For babies, starting ERT early can help them sit, crawl, or even walk, and protect the heart. But it's not a full cure. Physical therapy, breathing support, and heart monitoring are also key. Think of it as a team effort: medicine, movement, and monitoring. Can we prevent Pompe disease? Since it comes from inherited DNA, you can't prevent it like a cold. But you can prevent late diagnosis. Imagine you're planning a family, and no Pompe runs in your bloodline. You can get tested, both partners, to see if you carry the faulty gene. It's like checking the car engine before a long trip. If both are carriers, there's a 1 in 4 chance each child will have Pompe. With that knowledge, you can plan for early testing at birth. Newborn screening in many places now checks for low GAA enzyme, catching it before symptoms start. That's prevention through awareness, knowing your genes, testing early, and acting fast. You can't stop the typo, but you can catch it early, like spotting a typo in a recipe before baking a bad cake. Scientists aren't stopping at ERT. Right now, they're testing gene therapy. Imagine sending a corrected D/NO instruction into cells so they make GAA on their own. Early trials show promise, especially in babies. Think of it like upgrading from renting tools to owning them. Other studies are working on chaperone drugs, tiny helpers that fix broken GAA enzymes instead of replacing them. Also, researchers are finding better ways to measure muscle strength and breathing in patients, so treatment can be fine-tuned. And there's hope. One child in a gene therapy trial is now walking, something rare in severe infantile cases. These advances mean the future isn't just about managing Pompe, it's about healing it from within.